Hello, welcome to ANA community. In this particular video, we are going to discuss the concept of Krichrasadhya Vyadhi Lakshana. The term Krichrasadhya Vyadhi Lakshana refers to the criteria which are helpful to determine the difficult curability of an illness. So, the Charaka says, निमित्त रूपाणां मध्यमे बले काल प्रकृति दुष्याणां सामान्ये अन्यतमस्य च गर्भिणी वृद्धबालानां नाति उपद्रव पीडितं शस्त्रक्षाराग्निकृत्यानाम् अनवं कृच्छ्रदेशजं विद्यात् एकपथं रोगं नातिपूर्णचतुष्पदं द्विपथं नातिकालं वा कृच्छ्रसाध्यं विदोषजम्. Let me repeat. निमित्त रूपाणां मध्यमे बले काल प्रकृति दूष्याणां सामान्ये अन्यतमस्य च गर्भिणी वृद्ध बालानां न अति उपद्रव पीडितं शस्त्रक्षाराग्निकृत्यानाम् अनवं कृच्छ्रदेशजं विद्यात् एकपथं रोगं नातिपूर्णचतुष्पदं द्विपथं नातिकालं वा कृच्छ्रसाध्यं विदोषजम्. Charaka 10th chapter. The description goes like this. If the Nimitta Purva Rupa, they are having the Madhyama Bala. The term Madhyama Bala in the sense they are having the moderate in severity. If the person is having the Hetu Sevana, little bit increased, if the Purva Rupa is of moderate nature, if the Rupa is of moderate nature, then it is considered to be difficult to treat. Kala Prakriti Dushana Samanyaha. In the sense, if the Kala is having the conducive quality to the vitiated dosha or disease manifesting dosha. For example, if the person is suffering from the Pitta dominant disease and if the person is having the aggravation of the symptoms in the mid-noon or midnight or during the Sharad Rutu, etc., then in that particular situation, it is considered to be difficult to treat. The Prakriti should be, if the Prakriti is similar to the disease manifesting dosha. In the sense, if the person is suffering from Pitta dominant disease and he is having the Pitta Prakriti, it is considered to be Krichrasadhya in nature. Dushya, if it is having the similar qualities of disease manifesting dosha. In the sense, if the person is suffering from Pitta dominant disease and if the person is having the involvement of the Rakta as well as Sweda or Rakta or Sweda, in that particular situation, it is considered to be difficult to treat. Garbhini Vruddha Balaram. In the sense, if the lady is pregnant and in elderly individuals and in children, the disease, if that manifests, it is little bit difficult to treat. If the person is having a few Upadrava, that is difficult to treat. If the diseases manifested in an individual, if they are treated by either surgery or by Kshara application or alkali application or by Agni karma or cauterization, then it is difficult to treat. If the duration of illness is prolonged, if the person is suffering from the illness from longer duration, it is difficult to treat. If the person is having the affliction of Krichradeshaja, in the sense, the body part, if that is considered to be afflicted, which is difficult to treat. For example, if the person is having the Sadhya Pranahara Marma affliction, in that particular situation, it is difficult to treat. If the person is suffering from one Rogamarga, and if there is deficient one Chikitsa Chatushpada, any 1, 2, 3, etc., then it is difficult to treat. If the person is having the two Rogamarga affliction, or if there is two dosha affliction, in that particular situation, even though the disease is of shorter duration, it is considered to be difficult to treat. Regarding the description of all these, whenever if you think about there are two images. Left image is showing only one cigarette smoking, whereas the right image is showing multiple cigarettes already smoken. So here, the one Nidana that is considered to be where multiple cigarettes are already smoked. In that particular situation, it is considered to be Krichrasadhya in nature. As far as the Madhyama Pururupa is concerned, when you think about the two images, the child that is having the very mild Pururupa manifestation, whereas the elderly person is showing comparatively a severe form of Pururupa as such. In that particular situation, the elderly person may have the Krichrasadhya Vikara. As far as the Madhyama Rupa, in the sense the extreme left image that is showing localized the manifestation, whereas the right image that is showing generalized manifestation. When you think about the percentage of the body part afflicted, if the left image is showing only around 2 or 3% of the body affliction, whereas the right side of the image may be showing more than 50 or 60% of the body affliction. Of course, this is considered to be Krichrasadhya in nature. If the person is having the Prakriti, if the person is having the Tulya Guna Dushya, that means if the person is having the affliction of the Dushya, that is considered to be the having the uh, similar quality of the dosha as well as dushya. In the sense, in this particular image, he is having the pitta dosha vitiation. In the sense, the tulya guna dushya, that may be either rakta or sweda, or rakta and sweda. If there is affliction of rakta or sweda, rakta and sweda, in case of pitta dominant disease, that is considered to be difficult to treat. Tulya prakriti and vikrita dosha. In the sense, the in this particular image, the person is suffering from pitta dominant disease, and if the person is of a pitta prakriti person, then it is considered to be tulya prakriti and vikrita dosha. That is difficult to treat. Tulya kala gunastulyaha. In the sense, if there are two images here, one that is showing the body part and another one is showing the uh, environment. If the person is exposed to such kind of the environment, there may be a possibility of Shita guna increase as well as Ruksha guna increase in the body. That's how, when you think about the environment also, that is mainly having the Shita as well as Ruksha quality there. Hence, it will be difficult to treat. In case of the Garbhini, Vruddha and Bala, they are the specific, what do you say, that the conditions of the body. Whereas in case of the Garbhini, the woman will be having the fetus, which is considered to be vulnerable to any of the potent medicines. So that means any potent medicines cannot be given in case of the pregnant women. Hence, if any disease occurring in pregnancy, that is considered to be difficult to treat. Whereas in case of the vruddha, that is elderly individuals, they will be having the emaciation of the body. So that is atrophied cells that may be present, or dhatukshaya may be observed. So that is the reason potent medicines cannot be administered in case of the elderly people. Whereas in case of the children, they are having the full-blown dhatu, that is fully developed dhatu may be absent. Hence, the bala, they are not being given potent medications. That's why these are the three specific conditions where if any disease manifests, that is difficult to treat. Shastraksharagni krityaha. If the person is suffering from any of the disease and that is treated only by either shastra, that is the surgical instruments, or kshara, that is application of the alkali, or agni, or application of the cautery, then in that particular situation, that is considered to be difficult to treat. Anavatva, that is the duration of the illness is prolonged. Here there are two timelines, Mr. X and Mr. N. Mr. X is having the timeline of 3 days from the appearance of the symptoms till the appearance of the visiting the doctor, whereas the Mr. N is having the 10 days duration from appearance of the symptoms till the day of visiting the doctor. When you think about the clinical manifestation. So here the person X, that is considered to be having the shorter duration, and person N is having the longer duration. That is the reason Anavatva, that is because of the duration of the illness is prolonged, Mr. N is having the Krichrasadhya Vikara when compared to Mr. X. Then regarding the Rogasya Upadrava, Rogasya Upadrava should not be there. If it is there, then it is Krichrasadhya. For example, if the person is suffering from the skin disease, if there is a puya or pus accumulation, that is considered to be an Upadrava. If there is involvement of the rasa and rakta dhatu affliction, if that is being observed, then it can be considered to be the Upadrava. If there is involvement of the rasavaha as well as raktavaha srotomula, rasavaha srotomula in the sense hridayam moolam dashacha dhamanyah, whereas raktamule yakran moolam prihacha, if there is involvement of these organs, then it is considered to be difficult to treat. And if the person is having the occupation, for example, if the person is doing the work in the field or farm, or in the, what is it, in front of the sun, that is considered to be difficult to treat. That is the predisposing factor for the flaring up of the symptoms in case of the skin diseases. If the person is having the rogi bala reduction, and if there is chronicity of the same illness, the recurrence of the same illness, then it can be considered as Upadrava. In that particular situation, that is considered to be Krichrasadhya in nature. Further, one Rogamarga affliction, but deficient Chatushpada, either there may be Bishak or Dravya or Paricharaka or Rogi. So that means Bishak, if the person is not able to give the adequate line of treatment, if he is not in a position to decide whether which particular medications to be given, so whether is it Vamana Sadhya or Virechana Sadhya or Basti Sadhya or Nasya Sadhya, etc., or whether it is the Rasayana Sadhya or whether it is Shamana Sadhya, if the person is not able to decide, then it is difficult to treat in that particular situation. Dravya, which type of the Dravya has to be given? Whether it has to be simple, the milder form of the medications may be necessary, or potent medications are necessary, or whether is it possible to treat the patient by Shodhana or Shamana, etc., or is it possible to treat only by following proper Pathya and Apathya, etc., if that is not being able to decide it, then also it is, even though one Rogamarga affliction is there, then also it is difficult to treat. Paricharaka, if the attendant or the who are giving the treatment as prescribed by the doctor, if it is not proper, in the sense, if the person is, or if the attendant is not able to give adequate line of the snehana therapy or swedana therapy, in the sense abhyanga is not being properly given, or swedana or fermentation therapy is not being given properly, and if the vamana is being planned soon after the stoppage of snehapana, or virechana is being done after 7 days of snehapana, etc., that is considered to be one of the basic factor to have the prolongation of the illness as such. Rogi, if the person is not able to recollect the information regarding their discomfort, regarding his discomfort or her discomfort, regarding the aggravating factors and relieving factors, etc., regarding the severity of the illness, etc., regarding the source of the entry of the pathogen, if the person is not able to recollect, then such kind of the disease, even though there is one Rogamarga affliction, then it is difficult to treat. If there is two Rogamarga or affliction or two Doshagati is being afflicted, in one sense, it is the Urdhvagati is being noted, wherein the person may be having the either nausea or vomiting or aruchi may be observed, or otherwise in the second instance, that is Adhogati of the dosha, wherein the person may be having the diarrhea-like symptoms, that is two doshagati as such, that is difficult to treat. Or otherwise, if there is affliction of the koshta, the right image, the plus, the person is having the pain in the left knee joint, that is indicative of a 2 Rogamarga affliction, wherein it is also considered to be the one variety of the dosha gati as such. That is considered to be difficult to treat. Plus, if there is 2 dosha that is being afflicted, there are two images. These two images showing the person may be having, persons are having the joint pain. In the left image, simply the joint pain is being present, whereas on the right image, the person is having the joint pain as well as swelling. In that particular situation, the person who is having the simple pain, there will be Vata dosha affliction only can be seen. Whereas the person who is having the pain as well as swelling, there may be a possibility of Vata as well as Kapha dosha affliction. So that means the one which is difficult to treat is where there is two dosha affliction are being seen. Whereas one dosha affliction may be comparatively easier to cure. To sum up, Krichrasadhya Vyadhi refers to the diseases which are treatable with difficulty. So, Charaka says, Nimitta Purarupana Madhyame Bale Kala Prakriti Dushanam Samanya Anyatamasya Cha Garbhini Vruddha Balana Na Ati Upadrava Veditam Shastraksharagni Krityanam Anabam Krichradeshajam Vidyat Ekapatham Rogam Nati Purna Chatushpadam Tvipatham Nati Kalam Va Krichrasadhyam Vidoshajam. Charaka Sutra, 10th chapter. That's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. What is the one video that you'd like to hear in the coming days in this particular channel? Mention that topic in this particular comment box below and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.